Radial nerve floss is a neuromobilization technique for the radial nerve, and for those that may have pain, numbness, and tingling along its distribution. The radial nerve, after it branches off the brachial plexus, basically runs through the posterior shoulder, the tricep, and then through our forearm extensors, and supplies the back side of our hand, and is responsible for all the sensation in that distribution. So those that may have tricep pain, or pain that could be associated with the lateral epicondyle of the elbow, or even pain within this aspect of the forearm, maybe a component could be related to entrapment of the radial nerve. Best way to figure that out is to have a licensed healthcare provider, such as a sports rehab chiropractor, physical therapist, assess you and make sure you know exactly what you're dealing with, and that if these techniques are going to be appropriate for you. That said, I'll demonstrate the radial nerve floss. I'm going to show you from the side, because basically we're going to be going through some flexion and extension of the arm. We're going to go through flexion. As we go through flexion, we want our palm up, and then as we go through extension, we're going to go through a little bit of internal rotation. So we'll rotate the hand, thumb towards the ceiling, and then we'll get a little bit of flexion through the wrist and the fingers as well. So to unwind that, we'll go through some external rotation, flexion, and supination of the hand. So the hand will look like this, okay? And then we're going to reverse that. So we're going to go through internal rotation, extension, and some flexion here at the wrist, and we should feel some stretch or flossing along that radial nerve distribution, if in fact we are getting at an entrapment.